So in dealing with the lumbar spine, there's a lot of factors that could come into play that can cause low back pain. All right, low back pain can come from the disc, can come from the facet, can come from multiple levels, can come from a level that you think it's hurting down here, and meanwhile it's hurting up here. So you really need to make sure you're getting the right diagnostic care to figure out what in the world is going on. All right. So one reason I say this is because a lot of doctors out there, not all, but a lot, will, once you get imaging, whether it be an x-ray or an MRI, they will start to treat that image before they will treat the person. And so that becomes a huge issue because you wonder why you're not getting better. And meanwhile, they're injecting the wrong area because on MRI, you may have a disc bulge here, but your pain may be upstream, or your pain may be your major pain may be a facet at a different location. But what they're looking at is, oh, that's got to be the pain generator. So I'm going to inject that area. I'm going to treat that area instead of treating you, the patient, which can be a huge issue. So make sure even if you get imaging, which is fine to have, but also understand just an image is not you. An image is a picture of what the structure looks like, but it does not tell you where the pain is coming from. So don't always rely on imaging to give you all the answers. A good orthopedic exam, a good palpation exam. I find that a palpation exam is better than almost anything because what you're going to find is you're going to find those areas that do not move. You're going to find the areas that are misaligned. You're going to find the areas that generate pain. And what motions and movements generate pain. Is it right rotation, left rotation, et cetera, et cetera. So then you can figure out location. And then you can also, most of the time, you're going to figure out if you can take that information, then correlate it to imaging, then you're going to figure out a much better plan to figure out how to get you better. And if we can get you better, then you're going to obviously treat in the right spot.